Welcome back to Daytime. I think there are a lot of issues out in the community that people aren't necessarily always so aware of or don't have great information about, and I think autism is one of those. And we have Kay Narula with us here today who's going to give us a little bit more information on it, and maybe for families out there dealing with this within their own family, how they can get a bit more support. So thank you for being here today.
Thank you.
So why don't we start off for those who maybe aren't so aware as far as what autism actually is, if you could maybe explain a little bit about what it is for us.
Sure. Autism, by definition, is a neurodevelopmental disorder. It's a complex disorder because it manifests itself in different characteristics. But there are three main core areas that you will find impairments in or delays in, one being the language delay. That would be like verbal and nonverbal communication impairments. Second being social interaction, so not interacting with peers, others, families, and friends. And third main core impairment you would find would be like restrictive or repetitive behavior, like flapping, rocking back and forth, or even behavior, anger, aggressive behavior, such you would also see in autism as well.
Right. And in terms of autism here in Peel or in Canada in general, what are the numbers looking like? Are they pretty staggering?
Well, autism once was thought as a rare mental disorder, but now it's actually known to be one of the most common mental disorders. Estimated 1 out of 166 people do have autism. I just recently checked the statistics from Autism Ontario, and statistics said there are about 70,000 children with autism or autism spectrum disorder in Ontario itself.
70,000 in Ontario.
On
wow,
Ontario
that's
itself.
really, really
high.
Now, why do you think the rate is so high these days? There are a lot of speculations that the inoculations children get at a very young age have something to do with it.
Actually, the reason being the rates is so high is just that the diagnosis has gotten better.
Okay.
You do find practitioners who are getting specialization in looking for if kids do have autism. Before, it did go misdiagnosed a lot before. Just recently we are coming because, well, there is no cure and we don't know what autism, the reasons behind autism, so we don't have actual medical tests, a blood test or genetic testing. It's actually based on skilled, expert psychologist advice that if somebody has autism, it's all based on behavioral skill testing.
Okay.
And I think so that's one of the reasons that the rates are so high right now.
Now, Kate, what about a child who suffers from autism? I mean, when do you know? I mean, because this can come later in life, right? Or is it from when they're born?
Well, autism, it manifests itself by age 3. So you would,
okay.
by age 3, it's just, again, as I said, that it does go misdiagnosed for a really long time, and that's why a lot of people don't realize that they do have autism. Because, again, autism literally has a broad spectrum, so you can have mild autism characteristics, and then you can have severe autism characteristics. That's why it can go misdiagnosed. So you would not find out. Sorry, what was your question again?
About like how would you know, like how do you find out your child? Like what are the signs parents should probably
So
look
you
for?
would actually look for milestone delays, and if you would see if your child is not meeting some of the milestones. So for example, by age 1, your child should be cooing and babbling and gesturing and pointing to reach to desired objects. And by age 2, your child should be actually using 2-word phrases like and using nouns and verbs together, like baby sleeping and something like that. So if you see any of those impairments and delays, and if you see the child is not meeting any of the milestones, then definitely you would speak to your family physician, and the family physician then would refer you to a pediatrician, and from pediatrician you would go to a psychologist. And again, autism being such a, again, when I stress so much that it's a broad spectrum disorder, that a multidisciplinary team has to be involved in order to diagnose such a
It sounds pretty strenuous though, right? Like, I mean, going through all those meetings with all those different doctors and all that, I mean, it must be pretty hard, right?
Right. Now, what about some of the treatment options for those who do have someone who's afflicted with autism?
Again, there is no cure for autism right now, but the treatment can definitely help. Right kind of treatment, right kind of time in life can definitely help for these children with some of the impairments or delays that you do see on social skills and language or repetitive restrictive behavior that we just talked about. So one of the evidence-based practices that Ontario government also supports is IBI, Intensive Behavior Intervention. Actually, our organization, Hope Autism Services, do provide that as well. And it has actually shown dramatic differences in kids with IBI services or IBI treatment to go on life, being more independent and having all those skills and integrate in society more independently.
Okay. And for anybody with the who wants information, let's just say they're like, you know, this could be my child. For any parent out there who's watching this saying, you know, I may have a feeling. Can they contact Hope Autism in terms for advice and all that before they go to a doctor?
Definitely, they can always contact. They can visit our website, www.hopeautism.ca. We do have tons of resources on there, and then we can, once they contact us, we can have them contact a psychologist, and from there we can help them look for resources, have them get a diagnosis confirmation if they require that, or help them get a pediatrician who might be able to help them further. But
Fantastic.
definitely
Now, what about as far as social acceptance? Can children with autism live a fairly normal life?
Definitely, again, depending if they do get treatment or help or resources when they're really young. Again, there's a lot of research to back up the data that earlier in life you do start getting intervention or treatment, your chances of getting better and integrating into society is way much higher comparing to somebody who doesn't get any treatment in life.
So is there different ends of autism though? Is there one person who have a more of a severe autism problem than the other?
Yes.
Or there is, I didn't know that.
Oh yeah, autism is actually a spectrum disorder. So again, you can have any number of characteristics ranging from any mild autism to severe autism.
Oh, okay,
so mild autism,
I
you
thought
could
just
be
autism was like you had it or you didn't, right?
Right. So autism, literally, we call it autism spectrum disorder because given the spectrum of a wide variety of spectrum, that in mild, a lot of time you'll be speaking to a person, and if you were not expert in the field, you would have no idea that the person have autism because they are able to adjust to their surroundings and they have picked up the strategies how to deal with their impairments. But then you would find people with severe end on spectrum of autism as well, where you would notice it right away that somebody does have some of those delays.
More drastic, yeah, for sure.
Now, what about financial burdens on families? I'm sure this costs quite a bit of money. Does the government help at all when it comes to any of this?
Definitely. We are so fortunate to be in a country like Canada.
Yeah, we are. When it comes to these types of things, yeah.
We do have, even though the treatment for autism currently is not covered by a WHIP, but Government of Ontario, especially Child and Youth Services, does provide a lot of funding for people or individuals afflicted with autism. Especially there are almost $60,000 per year per child that Ontario government does spend providing them with treatment. On top of that, government does provide like tax cuts, assistive devices program, special services at home, and also there are a lot of day camps and day programs.
Well, it sounds like there's a lot of options for those people who are looking to find out more information. If you need more information on this topic, you can go to www.hopeautism.ca or call 416-273-1222. There's always help out there in the community. It's great to be more informed.
Exactly. You want to make sure you use your resources, especially when they're right there in front of you. Stay tuned. We have lots more to come right after the break.